Member for Vancouver-Fairview.
Honourable Speaker, perhaps the minister doesn't understand that anxiety is being caused by the removal of services that people do depend on, that vulnerable people depend on, and that are matched to the needs that they have. Honourable Speaker, the Pine Free Clinic has been part of the community bordered by Vancouver-Fairview, Vancouver-Point Grey, and Vancouver-False Creek for 4 decades. If it closes, young people in Vancouver will lose a critical lifeline. This is a place where they can ask questions about sexual health or get help coping with depression. As one patient writes, and I quote, "Any questions I have, anytime I'm scared, I know I can go to Pine Free and be taken care of. I don't have access to anywhere else." If this clinic disappears, many young people will struggle alone. Is the minister turning his back on Vancouver's community health clinics and the people who depend on them, or will he pledge today to keep Pine Free Clinic open?
Minister of Health.
Thank you, Honourable Speaker. And as I mentioned, we know that change is very difficult for the members opposite. They cannot think that anything should ever change, even though, Madam Speaker, that the redesign, the member opposite is concerned about youth. The redesign will actually improve access to service for youth through the creation of the Youth Hub at Ravensong, as well as additional physician hours at the Three Bridges Primary Care Clinic and an increase of primary care physician resources at the East Van Public Health Youth Clinic. Madam Speaker, I know in the NDP world things should never change. That is obvious when we look across. But Madam Speaker, we will always use the resources of the taxpayers of British Columbia to optimize health care, to make sure we get the very best results and ensure that we meet the needs of the most vulnerable people in our society.
Here, here. Recognizing the member for Vancouver-Point Grey.
Thank you, Honourable Speaker. Honourable Speaker, we've had 40 years of all-party agreement that youth need a dedicated clinic in Metro Vancouver. But this minister knows better. Let's hear about the changes, the revisioning that he's talking about. The Pine Free Clinic staff have received their layoff notices effective October 31st. After it closes, his government will be sending vulnerable youth from across the region to the very same clinics that serve street-involved adults struggling with chronic and severe addictions, including in the downtown east side. Will the minister pledge to support a dedicated youth-only clinic so that young people can get the services they need in a safe and supportive environment?
Minister of Health.
Thank you, Honourable Member. Not only do the members opposite have difficulty understanding change, they apparently have difficulty hearing the answer to the last question. Honourable Speaker, when I mentioned that the Youth Hub will be created at Ravensong to improve access to service for youth, that in fact there will be an East Van Public Health Youth Clinic located at the Robert and Lily Lee Community Health Centre to make sure that there are supports in place for youth. Madam Speaker, we just doubled the supports for youth at St. Paul's. We have increased supports for youth throughout the province of British Columbia. We will continue to do that, Madam Speaker, but that doesn't mean that we will just have one model and see it through to the end of time. We will respond to the needs of the patients of British Columbia and provide them with the interdisciplinary health care that they, in fact, deserve and that will give them the best results possible, Madam Speaker.